Elizabeth Wales, HCA 415, Community and Public Health, Dr. Michelle Clemens, November 11th, 2014. Public and Community Health, Power and Limitations. Thesis: Public health efforts greatly improve the well-being of many communities through an efficient organizational structure, but these efforts are accountable to legal, ethical, and financial dimensions, which is why communication between communities and public health programs is essential for community improvement advancements. Public health role versus community health role in the well-being of populations. Public health and community health work hand in hand at times, but they function at different levels, where both public and community health have much the same goals to help individuals live more healthful lives. Each has its own distinct advantages. Committee on Public Health Strategies to Improve Health Institute Medicine, 2011, characterizes public health in these terms in the article For the Public Health, the Role of Measurement in Action and Accountability. One of the distinguishing features of public health is its mission to protect the health of an entire population, page 22. In contrast, Friss et al., 2013, characterizes community health in these terms. Community health refers to the health status of a defined group of people and conditions to promote, protect, and preserve their health. An example of community health is the level of health in a specific city, such as Ann Arbor, Michigan, Berkeley, California, or New Orleans, Louisiana. Included within the definition of community health are activities carried out to safeguard, maintain, and promote the health of the residents in a community. In the well-being of populations, public health often has more resources available than community health, but community health workers understand the dynamics of individual geographic areas and may know best how to amend health challenges confronting that particular population's well-being. For further clarification in regards to the role of community health work may be gained by Martinez et al. 2011 in the article Transforming the Delivery of Care in a Post-Health Reform Era. What role will community health workers play? The unique identity of community health workers as members of communities they serve could help not only to improve access to primary and preventative care, but also to identify population-level challenges to improve the health of a community, page 3. Public Health Organizational Structure. The public health organizational structure is a part of an intricate network beginning with the executive secretary and including the many branches of political, social, and international organizations dedicated to providing healthful lifestyles in multitudes of individuals. Friss et al. 2013 explains in Community and Public Health that public health services function under state public health agencies and have oversight responsibility for safe practices of healthcare service using a system of licensure and credentialing services. Public health is generally accountable for inspections and specific monitoring for healthcare and human service providers, Section 10.4. Physicians, registered nurses, licensed practical nurses, chiropractors, osteopathic physicians, mental health providers, dentists, social workers, alternative health service providers, and institutions such as hospitals, nursing homes, residential homes, in-home healthcare agencies, medical laboratories, imaging services, pharmacies, surgical centers, renal dialysis services, oncology centers, and various medical services providing clinical services operating under the supervision of public health in the organizational structure. Community health is also operates under public health, although community health is responsible for assessing and evaluating a target population and how to improve the well-being of that population. The legal and ethical dimensions of public and community health services. Legal and ethical dimensions of public and community services are primarily concerned with providing the greatest level of wellness for the most people while respecting individual rights as much as possible. Principles such as beneficence, non-maleficence, autonomy, and justice are pursued for the masses. The same principles must also be considered in regards to individual rights. Stephen Collin, 2006, eloquently writes concerning the legal and ethical dimensions of public and community services in Ethical Issues in Epidemiological Research and Public Health Practice. Ethical concerns in epidemiology and public health practice often relate to the obligation of health professionals to acquire and apply scientific knowledge aimed at maintaining and restoring public health while respecting individual rights. Potential societal benefits must often be balanced with risks and potential harms to individuals and communities, such as the potential for stigmatization or invasion of privacy. Paragraph 22. Funding of public and community health services. Funding of public and community health services is a delicate matter, as the amount of funds which may be used to improve the living conditions of individuals is practically limitless, and there's almost no other cause more worthy than that of improving the lives of families in healthful ways. Unfortunately, limits must be placed upon public health spending, however, and as available funds are not endless. Funding for public health services are obtained through both private and public resources. According to the World Health Organization National Health Account Database 2014, the United States spent 8.3% of its GPA on public health in 2013. This is significantly more than most countries, and yet there are multitudes of health needs that have not yet been met. There are many parties with invested interest in public health services in the United States. Frist et al. 2013 reports in Community and Public Health, the U.S. healthcare system structure and funding mechanisms are unique due to the blending of private and public resources. Section 10.4. Frist et al. 2013 continues. Significant players in the healthcare arena include a blend of private pay and employer-based insurance companies, Medicare, Medicaid, specific entitlements such as Title V, WIC, SHIP, CHIP, state, county, and local government expenditures and grants. In addition, there are programs funded directly through public health and other government agencies. There are 1,607 funding programs in addition to the above healthcare funders, Section 10.5. Public health is very important to those in the United States, and the financial contributions demonstrate this, yet the effectiveness of the use of the funds must always be analyzed, as there is still a great health disparity between the upper and lower SESs. The role of communication in community and public health programs. Communication is one of the public health and community health programs' core responsibilities. There are two primary messages that public and community health communicate. Public health education. Effective communication requires knowledge of the target audience and the best method of presenting information to that audience in an empowering way. This information is often in regards to health improvement, prevention, and substance abuse messages. Pravanta et al. 2011 suggests these basic questions when communicating public and community health information in Essentials of Public Health Communication. Who are you trying to reach? What do you want them to do? What factors influence their behavior? Which actions will most effectively address these factors? Page 160. To be effective in health communication, strategy must be considered carefully. Emergency messages must appear to be an emergency message, and by this character they are engaging to the concerned audience. Health education messages, however, must compete for the target audience's attention, and thus must be marketed effectively. Indeed, health campaign strategies are efforts involving budgets well into the hundreds of thousands, if not millions, of dollars. public health emergency messages. Effective communication for emergencies require a calm, controlled announcement detailing the circumstances and what individuals are advised to do who may be affected by the emergency. It is of pertinent importance that panic is reduced through the message and, in cases of complicated threats, no sensitive information is broadcasted. References.